Have you recently been diagnosed with plantar fasciitis? What sort of treatment have you had so far, and are you getting any better? Plantar fasciitis is by far and away the most common condition we treat here at Melbourne Podiatry Clinic. It tends to be related to the fact that it's chronic in nature and often doesn't get better by itself. A lot of the time, cortisone is prescribed as an early intervention, and the latest evidence is suggesting that cortisone isn't actually a very effective treatment for plantar fasciitis. The biggest problem with plantar fasciitis is that it tends to be chronic in nature, so it's something that builds up and comes on gradually over a period of time. And the problem with that is that as it goes, the body basically resets that as being the new normal, and we need to basically try and jump it out of that in order to actually get it to repair itself naturally. The other biggest problem with plantar fasciitis is that often it hasn't been diagnosed correctly. So a lot of times any foot pain in and around that area can be diagnosed as plantar fasciitis when in fact it's actually not. So it's really important that we do diagnose it before we launch into any treatment plan. So number one, we need to know where the pain is. And typically with plantar fasciitis, you're going to find pain around the heel area. It's likely to be slightly forward of the heel towards the arch and just on the inside, so the medial side of the heel. So if you basically just press in this area here, it's going to be sore. The other one is when are you getting the pain, and normally we find it's going to be worse in the morning. So you're going to wake up in the morning, put your feet on the ground, and you're going to find that your feet in that area is sore. In the treatment of plantar fasciitis, it's really important that we do one of two things. One, we encourage the soft tissue to repair, and number two, we offload it to allow that soft tissue to repair. So here what we use for encouraging the structure to repair is we use things like soft tissue therapies, progressive loading programs. We use shockwave therapy, which is a really effective treatment to try and jump it out of that chronic phase and get the structure to start to repair. And we also give you some home exercises that you can be doing yourself to try and facilitate this process a little bit more. The other one is offloading, and it's really important that if we're trying to get the structure to repair in the first place, we need to not take enough stress off it to allow that process to continue. So we have specific taping techniques designed specifically for offloading your plantar fascia. We look at your shoes, and we also look at things like shoe inserts, which are designed to perhaps a little bit more aggressively offload it if it's required. So what we tend to find is if we have a combination of encouraging the structure to repair, offloading it sufficiently to enable that process to continue, we should start to see some improvement in your symptoms in 1 to 2 weeks. So if you have any more questions regarding plantar fasciitis, feel free to comment below and we're happy to answer any more questions. Otherwise, you can refer to our website for more information.